Mr. Jean Njab is a medical laboratory scientist, and he joins us from our Abuja studio. So I'd like to thank you for joining us on the program.
It's a pleasure to be here. Thank you.
Let's start with your observation on the expansion of community testing for COVID-19, especially in the local government areas. Are you impressed at the speed, the level?
I'm impressed at the initiative. I'm impressed about the concept, but I'm more impressed about the operations. Now, it is interesting to know that most of the expansion has probably been targeted towards those areas that have high yield in terms of positivity. But what I'd like to see in the field is a capacity to operationalize and quickly take samples and move them to the laboratory for testing. That's exactly what I want to see. Everybody celebrating Ghana, celebrating Egypt, celebrating South Africa in terms of number of testing. What is happening in all of those countries is that the movement, the logistics about moving samples from the community to the laboratory is fast speed. And that's the component that I'd like to see fast-tracked in this process now, fast-tracked now in this process. So this is very, very important. So community spread, locating areas of high yield, that's fantastic. But let's operationalize that. Let's strengthen that. Let the state take ownership of this process and then move the logistics quickly to the molecular diagnostic laboratories.
Some states are providing local governments walk-in testing sites for increased testing capacity. They're also providing access and awareness, but surely not all at the same speed. But when you also look at perhaps the curve of the virus lately, some would say a downward trend, and we've also been told that it's not yet uhuru, but would you say that that downward trend would add to the laxity in our preparations as we, of course, look forward to curbing and stopping the virus?
I'm happy you're calling this a downward trend, but rather I'm a little bit cautious. I don't like to call this a downward trend because I know COVID-19 virus has a reproduction ratio about 3. Reproduction ratio there simply means that with one contact person that is infected and confirmed infected, that person has capacity to pass the virus to at least 3 people. So with a virus that has a serial interval, a series interval about 7 days, within 7 days, you have 27 people infected. So I'm a little bit cautious here. So what I'd like to see really happen is to strengthen the contact tracing. Something happened now in Bielsa, where they tested some students. Some students were found out to be COVID-19 positive. Now I'm a little bit I'm asking myself the questions. The paper they handled, how were they handled? How were they processed? How were they kept so that nobody would contract the virus, even though I understand we had all the protocols well respected and well documented in that part of the country. But these 27 or 20, I can't remember the number now, these students, can we see the contact tracing from those numbers? And that's what we want to see to confirm that really the numbers are going down.
And that's perhaps another question is, what are the contact tracing procedures that states are using? One other thing I'd like to get your thoughts on in perhaps a few seconds is the federal government says sample collection is still low. It has capacity to test 15,000, but states are testing between 2,500 and 3,000. How can states ramp up testing?
Very simple. What I like to see now, I like to see a number of medical laboratory scientists, particularly among the junior ones, those that have just graduated, they've just moved their internship, just select and recruit among all those medical laboratory scientists. They already have the capacity, they know the environment, they know the processes. It's only to move them into the field, let them strengthen the community team in the field. They will help collect those samples in the protocol and the way they are supposed to be collected, and then ship them and move them to the testing laboratories. So if you recruit more medical laboratory scientists, especially those junior ones that already conducted their internship, there's so many of them in the country waiting for this type of opportunity, and you're going to ramp up testing, especially the collection component, which is actually the demand creation, and then you're going to see the testing ramp up.
All right, so I guess there's, getting more people, more hands on deck. Thank you so much. We appreciate your time. Dr. Jean Njab, a medical lab scientist, thank you for joining us on the program.
I appreciate it. Thank you for having me.